Infectious diseases are disorders caused by organisms such as bacteria, viruses, fungi, or parasites. Now, many organisms live in and on our bodies. They're normally harmless or even helpful, but under certain conditions, some organisms may cause disease. Some infectious diseases can be passed from person to person. Some are transmitted by bites from insects or animals, and others are acquired by ingesting contaminated food or water being exposed to organisms in the environment, or by exchange of bodily fluids, much like the Ebola outbreak of Western Africa of 2014. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Dr. Antonio Crespo is Chief Quality Officer and Infectious Disease Specialist at Dr. P. Phillips Hospital here in Orlando. He's here to start our conversation about infectious diseases. Dr. Crespo, thank you for being with us.
Thank you.
So how do you define an infectious disease?
Basically, it could be any disease that is transmitted by a microorganism. It could be a virus, it could be a bacteria, it could be a parasite, or a fungus. Those are probably the most common.
We've heard a lot in the news about Ebola, and at different times during our history, certain diseases have taken the forefront. What are the most common ones?
We have a lot of them. Influenza, for example, is a very common one. The influenza, during the influenza season, a lot of people get sick. It's very easily transmitted from one person to another. And people who have other diseases or in the extreme of ages, they can be very susceptible and actually can become very ill from that. That's one of the most common infectious diseases that we can see.
And that's kind of seasonal. You know, we hear flu season, usually in the winter, but being in a tropical / subtropical climate like Florida, does it matter? Do you see almost everything all the time?
We see a lot of diseases here in Florida. We have a big migrant population from the tourists that visit our city every year. We also have a lot of immigrants. So we are exposed here to diseases that occur in any place in the world all around the year. So we really have to be prepared for any of them and know what's going on in any place of the world.
Now, there was a lot of publicity recently about a MERS incident at your hospital. Tell us, number one, what MERS is, and then how did you go about containing that?
MERS stands for Middle East Respiratory Syndrome, and it's caused by a virus called coronavirus. So it's a virus that is acquired through the airways and affects mostly the respiratory system, and it can cause severe difficulty breathing, and the mortality also can be quite high, up to 40%. Yes, we had the opportunity to take care of the second case of MERS in the United States in our hospital, in Dr. P. Phillips Hospital. The way you contain that is by rapidly identifying the ill person and isolating that person so you avoid transmission to other people.
That's the general protocol with most infectious diseases, right?
In general, when you have a transmissible disease, that's how you control it.
So what about those that are spread by insects? we hear a lot about mosquitoes, especially malaria is a big one you hear about. So how can people protect themselves?
Yeah, mosquito-borne illnesses, as you mentioned, in malaria. We have others that are more common in this part of the world, like dengue fever, or we recently have a new one called chikungunya fever that is also transmitted by a mosquito.
Now, how does that present itself?
It basically, it will be, patients have fever, and they also have a joint pain, joint swelling. So basically the way you control that is by, you protect yourself by using a mosquito repellent. That's the way you avoid the mosquito bites. And from a public health standpoint, using spraying the area to avoid, to diminish in the mosquito population. Basically.
What are some signs and symptoms that people should look for? And do some of those symptoms mimic other things? You know, if you were going to tell someone this is what to be on the lookout for, what would that be?
For this particular disease or in general?
In general, when you're dealing with an infectious disease, or can you even generalize?
Yeah.
I guess that's a better question.
Yeah, we are like detectives, basically. And when you see an infectious disease doctor, the doctor is going to ask a lot of questions. Sometimes people get surprised with the questions that we ask, but we ask questions about traveling, about pets at home, about some personal practices. So it's very, we go into detail because that will give us clues about what this could be. So yes, some diseases have particular symptoms that are very characteristic of that particular disease, but other can be very general, and you just have to have a broad idea and then do the proper test.
So when you mentioned traveling, are we talking about within the United States or anytime you leave the U.S., or do you want to know about travel in general?
Both. There
Okay.
are diseases in the United States that are more common in particular areas of the country. There are outbreaks that are going on in particular areas of the country, so it would be important to know. But also around the world. If somebody's coming from a different country, we need to know what is going on in that country when we take care of that person here.
What has been your biggest challenge as an infectious disease specialist, especially with where we are in Florida? People are coming in and out all the time from all over the world. And where your particular hospital is located, you're like right in the middle of tourist central. So what's been the biggest challenge for you?
Well, the biggest challenge that we faced was the MERS case, because it was the second case in the United States, and we basically wanted to be on top of that to be sure that didn't spread. At least that was our part of the job. And all the media attention that was created. So it was
it kept you on your toes,
exactly.
I would imagine. So are you, if you had to give one piece of advice to the audience in terms of what to be on the lookout for, what would you tell them?
I think it's important to always prevent if you can. The best way to prevent infectious diseases is by immunizations, vaccines. So if your doctor offers you a vaccine or to your kid any vaccine, there have been a lot of infectious diseases that have been eradicated or minimized in the world. Diseases like smallpox or polio that used to kill a lot of people in the past. Now they've been eradicated or close to being eradicated because of vaccination. Okay. So that's an important piece of advice that I would give to our people.
Okay. Dr. Crespo, thank you for joining us. We talked to Dr. Crespo about what happens at the medical one-on-one level. When we come back, we're going to talk about how infectious diseases are handled when you're talking about an entire community. Don't go away. Ben Kleekamp is an epidemiologist with the Florida Department of Health in Orange County, and he's here to continue our discussion on infectious diseases. Thanks for being with us, Ben.
It's great to be here.
What is an epidemiologist, and is that a medical degree?
It's not a medical degree, however, you can have a medical degree as an epidemiologist. What an epidemiologist is compared to a doctor is if a doctor is an investigator for that individual person, an epidemiologist is an investigator at the community level. So we try and make sure the community stays safe and healthy.
Okay, so how do you do that? What is the process? I mean, we talked to Dr. Crespo about certain kinds of infectious diseases and those that are mosquito-borne, which are the most common ones. So at what point do you step in and say, hey, something else is going on here other than just one person?
Sure. So doctors by law are required to report certain diseases to us at the health department. And we like to conduct investigations on that individual person. And that allows us to link different risk factors, maybe such as eating out at a restaurant or being bit by a mosquito in a particular neighborhood, back to each other so we can see if there's something maybe larger going on, so that way we can do an intervention to make sure that we protect the health of the community.
So you're kind of like disease detectives, I think was the term.
Yeah, sure.
Kind of like tracking it back to see where patient one came from.
If we can go back that far, a lot of times we don't get to go back that far, but our main goal when we're doing these investigations is to protect the health of the community. And so if we can find that source of that particular infection or that contaminated product, that's our ultimate goal, to make sure that our community stays as healthy as possible.
So when is it a problem? You know, we hear terms like outbreak, epidemic, pandemic. Can you break down what each of those means?
Sure. Outbreak and epidemic are pretty similar terms, but basically what it means is that we're seeing an increase of disease above what is expected. Whereas a pandemic is disease that's expected, but that's on multiple continents. And so that's where that...
Kind of like Ebola.
Well, yeah, Ebola is now that it's seen on multiple continents now. But a better example of that is influenza.
Okay.
The recent previous pandemic of H1N1 influenza was a pandemic. We had ongoing disease transmission on multiple continents.
So how does the process work? Once you've identified that, okay, this is something that's not just one or two people, how does that process work with the Department of Health?
Well, we track diseases at the Department of Health that are reportable to us. And so we're able to see is this above our baseline? And also, as we're actively doing the investigations, we're tracking the different risk factors. Again, a restaurant or a different area that they travel to see if there's some common linkage between the different diseases. And if that's there, then we're able to then start working backwards and piecing together the puzzle pieces to try and make sure that we can stop whatever may be causing illness in the community.
So is it common practice for the hospital or the physician to call you?
Absolutely.
Okay.
So there are different diseases that require different reporting timeframes. Something that would be very important would be like, let's say we had a suspected case of Ebola. The doctor would be calling us right away.
Okay.
But something a little less important, maybe a case of Salmonella, while it's going to be very important to make sure that we try and determine where that person got sick, it's not as critical as maybe an Ebola patient.
So at what point do you guys get worried?
At what point do we get worried?
Yes.
We try not to get worried. We try to make sure that...
That's a great answer.
Yes.
It's a great answer. We try not to get worried.
Yes. And so we're making sure that we are communicating as best we can on the common practices that we know that keep people safe. And so we try and make sure that the information gets out there correctly and rapidly to the community to make sure that everyone can make sure that they're taking the right steps to make sure that they can stay healthy.
So what are some of those steps? Are there some basic things that we can all do, regardless of the infectious disease we're talking about?
Well, there are different ways to stay healthy for different ones. And since we're on the topic today of mosquito-borne illnesses, let's talk about the Florida Department's message of drain and cover. And there are 3 steps. So drain means that we're trying to reduce standing water around the home. So that's where the mosquitoes are going to be breeding and multiplying. So making sure that, for example, bird baths are turned over regularly and washed out. So make sure that mosquitoes are not breeding in those bird baths would be a good step to make sure that mosquito levels around your home are low.
Okay.
The cover is covering your body with clothing or mosquito repellent to make sure that you don't get bitten. Now, we live in Florida here and there's lots of sun. So we want to make sure that if you are going to use suntan lotion and mosquito repellent, you put the suntan lotion on first and then the mosquito repellent.
Because otherwise you're just, you're
You're covering it all up.
Okay.
Yeah.
Okay.
And then finally is making sure that your windows and doors have screens on them. That way mosquitoes, because they can breed inside of your home. If you have a pot that has standing water, maybe for like a plant or something that you're growing inside, if there's water there, they can breed in that pot.
Okay.
So making sure that your doors and windows have screens on it is another way to cover and protect yourself from mosquitoes.
So can we say cover your mouth too when you cough?
Yes, definitely.
I'm saying that.
That's a very good practice. And you want to make sure that you're coughing into your elbow when you're
Okay.
coughing. That's a good practice whenever you're in public, in the home, on airplanes.
Especially on planes.
There you go.
So let's talk about traveling.
Sure.
How much should you report to your doctor when you're traveling a lot? There are a lot of people who travel for business and you don't even think about it
Sure.
because it's just part of what you do and maybe you're not going outside the country. Is that something that you should always alert your doctor to?
If you become sick to the point where you need to go see your primary care physician, you should absolutely be telling them about recent travel history within the past month to almost 2 months. Let them know where you were, so that way the doctor has all the information to make sure that he can correctly diagnose you, order in the right tests, so that way you can get treated as quickly as possible.
Now, what else should people know? Do you find yourself, when you're educating people about infectious diseases, saying pretty much the same thing all the time that we haven't talked about right now that you'd like people to know?
I think that, there are different messages for different diseases.
Okay.
One of the big things that we like to promote at the Department of Health is washing your hands. It's the best way to prevent, common enteric illnesses where it's more more of the diarrhea, vomiting symptoms that you get. Washing your hands will make sure that you don't get sick. So before you cook food, before you eat food, and just in general, it's a good practice to do throughout the day.
Okay.
The other thing that washing your hands will do is also respiratory secretions. Influenza season is when you're coughing, when you're sneezing, you're producing those respiratory secretions. And if you have those respiratory secretions from somebody else on your hands, and then you're touching your mouth or things, you can also get sick different ways.
Hand sanitizers, yay or nay?
Yay, absolutely. It's one way that you can absolutely help prevent illness by using that. However, it doesn't work against all bacteria and viruses.
But when you can't get to soap and water, it's the
a
next
great
best thing.
way to make sure that at least some of them will be killed.
Okay. Thank you for being with us, Ben.
Great to be here.
We will be right back. Don't go away. Living in Florida can be wonderful, especially Central Florida, but in any climate that is subtropical like ours, the risk of infectious diseases, especially those spread by mosquitoes, goes up. So remember, take personal responsibility for your health, wash your hands, cover any standing water, and make sure you report any symptoms to your doctor. We want you to be around to have more healthy connections. I'm Annetta Wilson. Thanks for joining us. We'll see you next time.